everyone. Ready for a deep dive into something pretty amazing?
I am.
We're talking about congenital heart disease.
Yeah, CHD.
CHD, and it affects,
About 1%.
yeah, about 1% of all the babies born.
Live births.
Live births. Yeah, that's a lot more than people realize.
I think so.
So we're going to unpack this whole thing.
Yeah, we're going to go from like the basics.
Yeah?
What is CHD?
What even is it?
All the way to like the crazy new treatments that are out there.
Cutting edge stuff, yeah.
Yeah.
So maybe you can start by giving us a definition.
Yeah, so CHD,
What is this thing?
congenital heart disease, basically means that a baby is born with some kind of abnormality in the structure of their heart or how their heart functions.
So it's not just as simple as a hole in the heart.
No, it's not just one thing.
Right.
It's a whole bunch of different things.
Oh, wow.
It's a whole spectrum
Okay.
of different heart problems.
Got it.
And broadly,
Okay.
we can put them into two categories,
Two categories.
cyanotic and acyanotic.
Okay, so cyanotic?
Cyanotic.
What does that even mean?
So cyanotic CHD,
Okay.
sometimes it's called blue baby syndrome.
Oh, okay.
That's where the heart isn't circulating oxygen-rich blood
Okay.
the way that it should.
So the baby's not getting enough oxygen.
Exactly.
Got it.
And that can be caused by a bunch of different things,
Okay.
like tetralogy of Fallot
Tetralogy of Fallot.
or transposition of the great arteries,
Oh, wow.
which is where like the major blood vessels are literally switched
Oh, my gosh.
coming out of the heart.
Wow.
So that's pretty serious.
Yeah, that sounds really serious.
Yeah.
What about acyanotic then?
Acyanotic CHD,
Yeah.
it's often less visible
Okay.
and, the symptoms might not show up right away.
Right.
So like later in life.
Uh-huh.
And in that category, we've got things like ventricular septal defect,
Okay.
VSD,
VSD.
or atrial septal defect,
ASD.
ASD.
Got it.
And those are where there are holes
Between the chambers.
between the chambers of the heart.
Okay, so even though they're not, like,
Yeah.
super visible,
Right.
they can still cause problems.
Yeah, they can still impact a child's health and development.
Oh, wow. Okay, so you just mentioned development.
Yeah.
And that makes me wonder, like, what are the things
Yeah.
that cause these heart abnormalities?
Oh, that's a great question.
Yeah.
It's really rarely just one single cause.
Okay.
Sometimes it's genetic,
Okay.
like with Down syndrome, or
Right.
Turner syndrome,
Yeah.
or DeGeorge syndrome.
Wow.
And then other times it's related to the mom's health during pregnancy.
Oh, okay.
So things like diabetes or infections during pregnancy, like rubella,
Oh, wow.
can increase the risk.
Oh, gosh.
Or exposure to certain substances during pregnancy, like alcohol or some medications.
Oh, wow. So it can be really hard to pinpoint
It can
the exact cause.
It can be really tough,
Yeah.
like a detective story.
Yeah, for sure. But what I think is really amazing is that doctors can sometimes even detect these problems before the baby is born.
That's right.
How do they do that?
So prenatal screening has come a long way.
Okay.
Fetal echocardiography.
Fetal echocardiography.
Okay. Which is basically an ultrasound
Okay.
of the baby's heart.
Wow.
Is super powerful.
So they can actually see the heart beating
Yeah.
in the womb?
They can see the structure of the heart. They can see
Wow.
how the heart is functioning.
That's incredible.
Yeah. It's amazing.
What about after the baby's born, though?
Yeah, so after the baby's born,
How are they diagnosed?
echocardiography is still a key tool,
Okay.
along with MRI and CT scans,
Right.
if you need a more detailed view.
Uh-huh.
But, one of the simplest and most effective tools
Uh-huh.
is pulse oximetry screening.
Pulse oximetry, like the thing they put on your finger
Exactly.
at the doctor's office?
Yeah, like the little clip they put on your finger.
Yeah.
That measures the oxygen level in the blood.
Oh.
So if the reading is low,
Uh-huh.
that can be a sign that the heart isn't pumping oxygenated blood effectively,
Oh, wow.
which could point to a heart defect.
So a simple test like that
It's a simple test,
can be life-saving.
but it can make a huge difference.
Wow.
Yeah,
So it sounds like we've got a pretty good handle
Yeah.
on the diagnostic side.
I think so.
But what about treatment?
Yeah.
It's not always just straight to surgery, is it?
You're right. Not every case needs surgery right away.
Okay.
The treatment for CHD is multifaceted.
Okay.
It really depends on the specific defect
Okay.
and how severe it is.
Got it.
So there's a range of different options.
Okay, so walk me through it.
Sure.
What are the approaches?
So first we've got medical management,
Okay.
which means using medications
Okay.
to support heart function
Okay.
and control symptoms.
So what kind of medications are we talking about here?
Yeah, great question.
And how do they work?
So let's start with diuretics. Yeah, think of them as like tiny plumbers for the body.
Tiny plumbers.
Yeah, they help remove excess fluid,
Okay.
which reduces the workload on the heart.
Okay.
So that can make a big difference for a child with heart failure.
Okay.
It allows them to breathe easier
Okay.
and have more energy.
So it's not just about fixing the heart itself.
Right.
It's about managing all the other effects, too.
Exactly.
Right.
It's about managing the impact that it has
Yeah.
on the whole body.
Got it. Okay.
Then there are ACE inhibitors.
Okay.
These relax and widen the blood vessels,
Okay.
making it easier for the heart to pump blood.
Easier to pump.
Yeah.
Okay.
And that can lower blood pressure and improve circulation overall.
I see.
And then you mentioned prostaglandins earlier.
Yeah, prostaglandins.
Yeah, those are really interesting.
What do they do?
So they act like chemical messengers in the body.
Okay.
And in the case of CHD, they can help keep certain blood vessels open,
Oh, wow.
which is super important for babies with certain heart defects
Yeah.
because it allows blood to flow properly
Okay.
until they can have a more permanent solution.
So it's like a bridge
It's like a bridge, yeah.
to a longer-term treatment.
Exactly.
Okay, awesome. What comes after that?
So beyond medications,
Okay.
we've got interventional cardiology,
Interventional cardiology.
which is a less invasive alternative
Okay.
to open heart surgery.
Got it.
So it involves using catheters,
Catheters.
those thin, flexible tubes,
Okay.
to access the heart
Uh-huh.
and perform procedures.
Okay, can you give me an example
Yeah.
of, like, what they might do with a catheter?
One common procedure is balloon valvuloplasty.
Balloon valvuloplasty.
Yeah, it's like a tiny angioplasty
Okay.
for the heart,
So they thread the catheter in.
right? They thread a catheter with a balloon on the tip into the heart,
Okay.
and then they inflate the balloon to widen a narrowed valve.
Wow.
Yeah, so it's less invasive than open heart surgery,
I see.
and it can make a big difference in blood flow.
That's incredible.
Yeah,
Okay.
or-
So what other kinds of things can they do?
Another option is device closure.
Device closure.
So this means inserting small devices through the catheter
Okay.
to close holes in the heart, like
Uh-huh.
the holes that you find in VSDs and ASDs.
Okay.
It's like patching a leak in a pipe,
Okay.
but instead of a pipe, it's the heart.
Yeah, patching the heart.
Right.
Wow. So we've got medications.
Yeah.
We've got less invasive procedures.
Right.
It's like a whole toolkit for treating CHD.
Yeah. There are a lot of different options.
But what about when surgery is unavoidable?
Yeah. So sometimes surgery is the best option.
Okay.
And when it comes to surgical interventions,
Oh, okay.
there are two main categories,
Two main categories.
corrective and palliative.
Okay, so break it down for me.
Sure.
What's the difference?
So corrective surgery aims to completely repair the heart defect.
Okay.
So a good example is the arterial switch operation
Okay.
for transposition of the great arteries. It's a complex procedure where the surgeon literally switches the aorta and the pulmonary artery
Wow.
to restore normal blood flow.
That's some serious surgery.
Yeah, it's a big surgery.
What about palliative surgery?
So palliative surgery is when a complete fix isn't possible.
Okay.
So the goal is to improve the child's quality of life
Okay.
by doing staged procedures
Okay.
that alleviate the most serious problems.
I see.
So a classic example is hypoplastic left heart syndrome,
HLH.
HLHS,
Yeah.
where the left side of the heart is underdeveloped.
Wow, that sounds really challenging.
It is. What do they do in those cases?
So with HLHS, the surgeons do a series of operations
Okay.
that basically reroute the blood flow.
Okay.
So the right side of the heart can do the work of both sides.
Wow.
It's not a cure,
I see.
but it does allow these children to survive
Wow.
and thrive.
That's incredible.
Yeah,
It really is amazing
it is.
what surgeons can accomplish.
Yeah, they can do amazing things.
But it sounds like even after surgery.
The journey's not over,
That's right. Treatment is just the first step
right?
in a lifelong journey.
Okay, so we're going to dive deeper into that
We are.
in part 2.
After a quick break,
Yeah,
we'll be back.
stay tuned.
Living with CHD, it really is a lifelong journey.
Yeah, it's a marathon, not a sprint.
Exactly.
So what does that actually look like for someone
Yeah.
with CHD?
So it really takes a village.
Okay.
You need a whole team of different healthcare professionals,
Okay.
all working together
Okay.
to provide really comprehensive care.
So, like, who are we talking about here?
We're talking about cardiologists,
Okay.
surgeons,
Mm.
nurses,
Wow.
dichologists,
Wow.
dietitians, you name it.
Really a whole team.
Yeah. Everybody focused on that individual's needs.
That's amazing.
So they're monitoring heart function,
Mm-hmm.
managing medications,
Yeah.
providing emotional support,
Wow.
really helping that person adapt to life with CHD.
So it sounds like it's not just
Yeah.
the physical aspects.
It's not-
It's the emotional
It's the whole picture,
social.
aspects as well.
Exactly.
Wow. And then as children with CHD grow up, there's another transition.
There is?
Moving from pediatric care to adult care.
That's a big one.
That must be really challenging.
It can be a really tough time for a lot of people.
What are some of the challenges that people face?
So there's always the potential for complications.
Okay.
Arrhythmias, which are irregular heart rhythms.
Okay.
They're really common.
Okay.
And they might need medication or procedures to manage them.
Okay.
Heart failure is another concern, as the heart might get weaker over time.
Right.
And sometimes CHD can affect brain development.
Oh, wow.
So you might see some neurodevelopmental issues, like learning disabilities or attention problems.
This sounds like early intervention.
It's key.
Is really important.
Yeah, to address those developmental concerns.
Right.
And also just to set them up.
For a healthy adulthood.
Absolutely. So early monitoring.
Ongoing monitoring.
And a strong support system.
Support system,
Would make a world of difference.
Absolutely. But let's not dwell on the challenges.
Right.
What I find really exciting is the future of CHD care.
Me too.
Like, we're on the cusp of some really incredible advancements.
Absolutely.
So give me the sci-fi stuff.
Okay.
So what are the big breakthroughs?
Imagine a surgeon putting on a VR headset.
Okay.
And walking through a complex heart surgery.
Wow.
Before they even make the first incision.
That's amazing.
That's the power of VR in CHD care today.
Wow. So it's like a surgical simulator.
It is.
But for real life.
But for real.
That's incredible. What else is out there?
We're also seeing huge advances in imaging.
Okay.
4D flow MRI.
4D flow MRI.
Allows us to see blood flow through the heart.
Wow.
In incredible detail.
So you can really see.
Yeah, it's like watching a river flow.
But instead of water, it's blood moving through the chambers and valves.
Wow.
So it helps us really understand how the heart's working.
Yeah.
And identify any potential problems.
So it's like they have this superpower to see the heart.
Like X-ray vision.
In a whole new way.
Exactly.
That's incredible.
Yeah.
So what about actually fixing the heart itself?
Right.
Is that where gene and stem cell therapy come in?
Yeah, you're on the right track.
Okay.
So gene editing technologies, like CRISPR, they have the potential to correct the genetic mutations that cause some types of CHD.
So we could potentially cure CHD?
Potentially.
At the genetic level?
Yeah, it's still early days.
Wow.
But the possibilities are amazing.
That's incredible. What about stem cells?
Stem cells are like the body's master builders.
Okay.
They can transform into different types of cells.
Okay.
So scientists are looking at ways to use stem cells to regenerate damaged heart tissue, which could be a potential solution for heart failure.
Right.
And reduce the need for transplants.
So using the body's own healing power
Exactly.
to repair the heart.
That's the idea.
That's amazing. Okay, and we can't forget about AI.
Right, AI is everywhere.
It's revolutionizing everything.
It is.
How is it changing CHD care?
So for CHD, we're seeing algorithms.
Okay.
That can predict a child's risk of developing certain heart defects.
Wow.
Which allows for early intervention.
Yeah.
And maybe even prevention.
Wow.
AI is also being used to personalize treatment plans.
Okay.
By analyzing tons of data.
Right.
To figure out the best course of action for each individual.
So it's like having a superpowered assistant for doctors.
It is.
Helping them make better decisions.
Exactly.
That's amazing. What other AI stuff?
One area that I'm really excited about is AI-powered wearable devices.
Okay.
That can monitor heart function all the time.
Wow.
And they can alert doctors to problems.
In real time?
In real time. So instead of just having those occasional checkups, you've got constant monitoring.
It's like having a cardiologist right in your pocket.
Exactly.
Wow, that's incredible, but I don't want us to get too focused on the high-tech treatments.
Right.
What about the day-to-day lives of people living with CHD?
That's a great point.
How can technology help them?
So imagine bioengineered heart valves and patches.
Okay.
That actually grow with the child.
Wow.
So you reduce the need for repeat surgeries.
That's amazing.
That's already becoming a reality.
Wow.
It's a much more durable and less disruptive solution.
Wow, that would be life-changing.
It would be.
For so many families, it's not just about extending life.
Right.
It's about improving.
It's about quality of life.
The quality of life.
Absolutely.
Okay, so what else?
And let's not forget about telemedicine.
Telemedicine.
Yeah, kids with CHD could get expert care and support from home.
Right from home.
Without all the stress and expense of going to the hospital all the time.
That's great. So technology can make care more accessible and convenient.
More accessible for sure.
What other innovations are out there?
So one area that's really interesting is immunomodulatory therapy.
Immunomodulatory therapy.
Yeah, this involves using the power of the immune system
Okay.
to protect surgical grafts and reduce complications.
So instead of fighting the immune system,
Yeah.
we're working with it to
Exactly.
get better outcomes.
That's the goal.
That's amazing. What are you most excited about?
What excites me most is seeing all these different technologies coming together. We're seeing this synergy between gene editing, stem cell therapy,
Yeah.
AI, bioengineering, immunomodulatory approaches.
Wow, it's like all these different pieces of the puzzle are coming together.
It's like we're getting a much more complete picture of CHD
And unlocking all these.
and unlocking all these new possibilities for treatment and prevention.
Wow. It sounds like we're on the verge
I think so.
of a paradigm shift
Yeah,
in CHD care.
absolutely.
Let's take a step back for a second
Okay.
and just think about everything we've talked about. We've explored this complex world
Yeah, we've covered a lot of ground.
of CHD,
We have.
how it's diagnosed,
Right.
all the different treatment options,
Yeah, the incredible advancements that are out there.
and all these mind-blowing technologies.
Yeah, it's an exciting
On the
time.
horizon,
It is.
this field is constantly
Is amazing.
evolving.
Pushing the boundaries
Absolutely.
of what's possible.
I agree.
It's been quite a journey.
It has.
We're going to be back in just a minute
Okay. Sounds good.
to wrap things up
All right.
and explore what all of this means
Looking forward to it.
for the future of CHD care.
Yeah, me too.
Stay with us. All right, we are back,
Back again.
ready to wrap up
Yeah,
our deep dive into CHD.
I think so.
So we have learned so much.
About this complex condition.
It's a fascinating field.
How it's diagnosed, the
Well,
treatments.
Yeah, and all the exciting new developments.
Yeah, all those mind-blowing new technologies.
It's really incredible how far we've come.
And it just keeps evolving.
Yeah, absolutely.
It's amazing. But I know you're always looking ahead.
Oh, of course. Always thinking about the future.
So what are you most hopeful about?
Well, for me, it's the potential for really personalized care.
Okay.
With AI and data analysis,
Yeah.
we're getting closer to a future where treatment plans are really tailored
Okay.
to each individual.
Wow.
Like, imagine getting a treatment plan
Yeah.
that's designed just for you,
Okay.
based on your specific heart defect,
Okay.
your genetic profile,
Uh-huh.
your overall health.
So it's not just treating the disease.
Exactly.
It's treating the person.
That's the goal.
Wow. And with gene editing and stem cell therapy,
Yeah.
it seems like we might actually be able to correct
Potential.
some of his defects
That's the dream.
at the source.
Yeah, wouldn't that be amazing?
So that would be incredible. So not just managing CHD,
Right.
but actually curing it.
That's what we're all working towards.
Wow. And even if a cure
Yeah.
isn't always possible,
Right.
imagine kids born with CHD
Yeah.
living long, healthy lives
Absolutely.
with minimal disruption to
Right.
their everyday activities.
That's the vision.
So CHD is no longer
Right.
a life-limiting condition,
Exactly.
but a manageable one.
It's about giving them the best possible quality of life.
Yeah, that's a powerful vision.
It is.
And it's inspiring to think about all the people who are making it a reality.
It's team effort.
Researchers,
Tax-
doctors,
Right.
nurses, engineers, advocates.
Everyone working together.
Wow. So it's not just scientists.
It's not just about the science.
It's a whole community.
It takes a village.
Yeah. And it's important to remember
Yes.
everyone listening
Absolutely.
really play a role too.
Everyone can make a difference.
By learning about CHD,
Yeah, spread the word.
understanding the challenges
Right.
and the triumphs.
The more people know, the better.
Yeah, knowledge is power.
Exactly.
And the more we know,
Yeah.
the more we can make a difference.
Absolutely.
So as we wrap up our deep dive,
Okay.
I want to leave you with this.
Right.
What do you think the future holds?
Oh, that's a big question.
For CHD care,
Yeah.
what breakthroughs are just around the corner?
Wow.
And how can we all contribute
Yeah.
to creating a world where CHD is no longer a burden,
That's the goal.
but a challenge
Yeah.
that we can overcome together?
A challenge we can face head on.
Well, thank you so much for joining us
Thank you for having me.
for this incredible deep dive
It's been a pleasure.
into CHD.
Yeah, it's been a great conversation.
Until next time,
Until next time.
keep learning, keep exploring,
Absolutely.
and keep asking questions.
That's what it's all about.